International Conference, Cardiopulmonary Resuscitation and Performance, Ability and Persistence of Health College. 20 for International Conference, Cardiopulmonary Resuscitation and Performance, Ability and Persistence of Health College. Department of Dental Hygiene, Kyungnan College of Information and Technology, Republic of Korea. Background and purpose. CPR refers to a life-saving act to resuscitate a person with cardiac arrest and consists of a series of processes that provide ventilation and allow voluntary circulation to be restored within a short time. According to a recent study on the number of cardiac arrest cases in Korea, the incidence rate of cardiac arrest per 100,000 people in Korea in 2021 is estimated to be about 64.7. Since cardiac arrest begins irreversible damage to the brain 4 or 5 minutes after it occurs, CPR by the first person who witnessed cardiac arrest is important to increase the survival rate of cardiac arrest patients. In order to increase the survival rate of cardiac arrest patients, it is important for witnesses to recognize the occurrence of cardiac arrest, start accurate CPR, and effectively use automatic defibrillators, and for this, awareness and education on CPR are required. Therefore, this study was conducted to understand the knowledge and performance of CPR for health college students who have received CPR education and to find out its continuity. Subjects and methods. Among the departments of nursing, dental hygiene, physical therapy, occupational therapy, and clinical pathology at K University in Busan, those who received CPR BLS education were targeted. The final data collection was conducted from November 1 to November 8, 2023. After explaining the purpose of the questionnaire, this study measured the knowledge and performance of CPR of health college students. The higher the score of the 5-point scale table of the performance measurement, the higher the performance was measured. T-test and ANOVA were used to find out the difference in knowledge and performance according to general characteristics. Results. CPR training experience was the most common within 3 to 6 months, with 30% 60 people, and to 8 hours of training was the most common with 70.7% 140 people. The average correct answer rate of CPR knowledge was 71.5%. In other words, they showed high knowledge in defining CPR and confirming consciousness, and low knowledge in how to operate an automatic defibrillator, AED. The performance ability of CPR was 3.59 points. Among the performance questions, checking the patient's consciousness level was the highest at 3.89 points, and you can accurately perform air injection and speed during an artificial hop with an ambu bag was the lowest at 3.17 points. There were statistically significant differences in the degree of CPR performance according to general characteristics in the department P0. 000 last educational experience P0. 000 and educational time P0. 001. Among the departments, the nursing department showed higher performance of CPR than other departments, and in the last educational experience, less than 3 months showed higher performance of CPR than more than 2 years, and more than 8 hours of training showed higher performance of CPR. Conclusion. Repeated education is expected to be necessary to increase the continuity of education on CPR, which is an essential competency of health college students who will be engaged in the medical field.